go now to Agnes, our colleague based here in Geneva from AFP. Agnes, can you hear us?
Yes, hello, Tarek, I can hear you. I wanted to add a question to something that Maria Kerkhoff said before. She said, if I understood well, that more and more, it appears that more and more young adults are in intensive cares. If she can give us some figures about that, and if she has any explanation. Thank you.
So thank you for that question. Yes, indeed, we are seeing more and more younger individuals who are experiencing severe disease. I should say overall, most of the people who are experiencing severe disease and ending up in ICU and needing advanced care are people of older age and are people who have underlying conditions. But what we are seeing in some countries is that there are individuals who are in their 30s, who are in their 40s, who are in their 50s, who are in ICU and who have died. We've seen some data from Italy, we've seen some data from China, we've seen some data from a number of countries across Europe where people of younger age have died. Some of those individuals have had underlying conditions, but some have not. And so what we need to better understand is why there are young people who are dying from this infection. There are still many unknowns at the present time, so I can't give you a complete answer on that. But what is important is that people who are infected with this, even if they have a mild disease, what is classified as a mild disease or a moderate disease still includes pneumonia. And if you hear anyone who has been infected, who explains the kind of disease that they've had, it's still pretty significant, even if you don't require hospitalization. But what we need to better understand, and these will come through these natural history studies, which are being conducted, of why are some people progressing from moderate disease to severe disease to critical disease? Why are some people progressing backwards from very, very severe disease to more moderate disease and recover? So these are really fundamental questions that we need to better understand so that we can improve our standard of care for anyone who is infected with this. There's also a large number of clinical trials that are underway that you're aware of that are looking specifically at therapeutics for COVID-19. And those are currently being conducted, and we're hoping for results of those in the coming months. So again, we can have more specific options for people for treatment for COVID-19.
But sorry, if I understood well, you were saying that at the beginning of the epidemic, there was more older people and that now there are more young people infected and in intensive care. Is it a change?
So it's not a change, but with more countries affected and more virus circulating, we're going to see maybe some slight differences in epidemiology in different countries. It's too early to conclude one way or another if this will be the same in all countries. As we mentioned before, it depends on the populations that are affected, that are infected. But what is important is that everyone needs to do what they can to prevent themselves from getting infected. And by preventing themselves from getting infected and taking those measures will prevent the onward transmission to someone else who could perhaps be more vulnerable. Mike?
And if I may add, there was a tendency at the beginning in the last number of months for almost a dismissive attitude to say, well, this disease is severe in older people and it's fine in younger people. And maybe that was a way of people assuring themselves that younger people were not going to be so badly affected. But we've been saying again and again in this forum and with our data, in Korea, even in Korea, who have managed to control the disease, 1 in 6 deaths have been in people under 60. In Italy, over the last 5-6 weeks, at least 10 to 15% of people in intensive care have been under 50. It's not that anything has changed. It's that we collectively have been living in a world where we've tried to convince ourselves that this disease is mild in the young people and it's more severe in older people, and that's where the problem is. And I think the evidence has been there all along, that there is a spectrum of severity, and it is definitely more severe in older age groups, but there is a spectrum of severity in younger people as well, and sometimes in younger people with underlying conditions and sometimes not. So I don't think there's been a significant change. As the numbers grow, as the clinical data is collected, we begin to see that this disease has an impact on the young as well as the old. But again, younger people tend to have a milder course of disease. But that is also younger people, and that is not to scare younger people to say, oh, you need to be careful because you may become very sick. In the main, younger people still have a milder course of disease. What we've also been saying is milder people who get sick can transmit the disease to people who are even more vulnerable. So there are two reasons here for younger people to avoid infection. One, it is not always a mild disease in your age group. And two, if you get sick and you start to transmit that virus, you may infect someone who's in an older age group who is vulnerable, and therefore you need to try and do whatever you can to protect yourself and protect others.
Thank you. Maybe I would like to add, in order to remind young people, I said several weeks ago that to young people in my message in our presser, in one of our pressers, that you're not invincible. And because we had cases actually how the virus was affecting young people too. Still, older people are more vulnerable, and people with underlying conditions are more vulnerable. But we have even now more evidence that it affects younger people too. And that's what we're saying today. But if you compare that to still, the senior citizens are the most affected, but we have now more and more cases also from the younger population.